So doctor, you're saying that you don't think it is a cancer, and even the ultrasound or the mammography is also not suggesting it is a cancer, but you're still telling me to undergo a biopsy. What is the reason behind this? So here I want to tell you guys that in breast, we have to complete triple assessment, meaning we have to do a first clinical assessment in the form of a detailed risk factor analysis, and then clinical examination, which is the first assessment. And the second assessment is in the form of an imaging, where we do a mammography or an ultrasound and sometimes an MRI scan, where we get an impression and it can further guide us to do any pathological assessment that we may have to. The third assessment is biopsy. So earlier people used to do fine needle aspiration cytology, so which is the false negativity rate or the inaccuracies are much higher with this modality. So we have shifted now based on scientific literature completely to a guided core biopsy, where under local anesthesia in the office we can actually take bits of the tissue from that breast lump or a lesion that we may be suspicious or even not suspicious, to prove that in fact what we're thinking is true, because imaging and clinical examination can only give impressions, but the final proof is with the biopsy. So even if the doctors think, if we think that the lesion could be a benign one, we still go ahead and suggest biopsy most of the times. So what do you think? A painful breast lump is more dangerous or a painless one? I know most of you are thinking, obviously pain is something ominous and can suggest some grave or serious underlying problem. But contrary to what is thought, I can tell you that as far as breast is concerned, a painless breast lump is more dangerous. So to understand this, let us see what can cause a painful breast lump. Infections, inflammations, or hormonal changes can cause painful breast lumps. Very rarely, of course, a cancer can also cause a painful breast lump, but most often than not, breast cancer or cancerous lumps present as painless lumps. So patients often come and tell me, it's been sitting there for a while, but it doesn't trouble me in any way. So why should I even be bothered about it? So here I want to make you aware that painless breast lumps are much more dangerous than painful breast lumps. So if you have got any lump, don't decide for yourself whether this is cancer or not cancer. So please come to the doctor and let them do the evaluation and guide you in its treatment.